Welcome back to the program. More than 1 million Australians experiencing mental health issues are too unwell for primary care, but not so much that they qualify for state services. A new campaign is aiming to help this so-called missing middle. The Country in Chorus campaign, spearheaded by Australians for Mental Health, is encouraging people to quite literally sing out for change. Joining me now live is Australians for Mental Health Executive Director Chris Gambian. Chris, thank you so much for your time today on this very important topic. Firstly, tell us about this missing middle. What is it? What's the situation?
Right, so unbelievably, most of us at some point in our lives will have some sort of mental health care needs. For a lot of people, they're fairly minor symptoms and they're things that you might go and see your GP about. You might go and get what's called primary care. And then, of course, at the other end of the spectrum, there are people that have got really acute mental health needs. These are people who require hospitalisation. They need quite a lot of intensive care. But there is a huge proportion of Australians in the middle, about 1.3 million people, we estimate, in Australia, who have got mental health care needs that are more complicated than your local GP can help you with, but still not so severe that you need to be admitted to hospital. And that's the group that at the moment is just not getting the care they need. Wait times to see psychologists and psychiatrists are just far too long. In some cases, people can be waiting 8 or 9 months to get an appointment with a psychiatrist. And we know that these are incredibly treatable problems as well, and people's lives can be dramatically better once they get the care they need.
1.3 million Australians, that's a huge number. Why then don't they qualify for state services? What's the criteria then for them to be able to get that help that they do need?
Well, I think one of the problems that we've got is that we haven't sort of built in a discussion about mental health into our whole society in the same way we have it about other physical health needs, for example. I'll give you a statistic. 1 in 5 of us each and every year will seek assistance for a mental health disorder of some kind. Over a lifetime, it's more like 2 in 5 of us. That's roughly the same number of people that might need glasses at any given time. Can you imagine a situation where we were saying to people who need glasses and know that as soon as you put the glasses on, everything is better, that, well, maybe there's not enough money for that. Maybe they should just try squinting a little bit. Maybe we shouldn't talk about it because it's a little bit shameful. We've got this problem where we're not talking about it enough. We're not raising our voices enough about mental health needs in Australia. It's still a bit of a taboo subject, but every single family in Australia knows somebody, has loved somebody that is struggling with their mental health. And what we're saying is we need to get to a place where, whether it's between ourselves, around our kitchen table at home, around the board table in your business, or even around the cabinet table in government, we're having a really honest conversation about mental health because it's something that affects us all.
Oh, absolutely it does. And I want to get to the campaign in a moment. You mentioned the wait lists. It's bad, obviously, in city areas, but even in the regions, how bad is it if people are waiting in parts of the cities 7, 8 months? What's it like out in the bush?
It's absolutely devastating. And you can imagine that over the last few years, we've experienced droughts, fires, floods, all kinds of natural disasters. Of course, they spike the mental health needs of the community. We've just gone through the pandemic, also spiked the mental health needs of the community. So, yes, in places like Sydney and Melbourne, the capital cities, it can be really tough to get the care you need. In the bush, if you go out to the outback, almost impossible. This is causing unnecessary agony in people's lives, unnecessary misery in people's lives, and unfortunately, in many cases, unnecessary deaths. It is incredibly solvable, though.
Absolutely. It's so sad to hear as well. Now, let's talk about this campaign. It's called A Country in Chorus.
That's right.
What is it? Take us through it.
Well, let me give you the backstory. So, some time ago, there's a great organisation called AIM. That's the Australian Indigenous Mentoring Experience. And they did a podcast about mental health. And they've got this thing where, for particular issues, they'll make a hoodie. Like a hoodie that you wear in wintertime, to speak out about a particular issue. And so they had a podcast about mental health. They were making a hoodie about mental health. And on that podcast, Maggie Beer, the chef, one of the things, a great Australian and a great mental health advocate, one of the things she said was, well, to look after my mental health, I like to sing in a choir. And that got us thinking that actually singing in a choir is good for two reasons. One is it automatically gives you connection between other people. You know, we know that one of the best things for people's mental health is just having connection with other people and having a community of people around them to support them. But we also know that the act of singing itself is really great for your mental health. So we had this idea that the whole country should be in chorus, speaking up for change in the way that we talk about mental health and the way that we act on mental health. And so A Country in Chorus was born. We've teamed up with Jonathan Welsh from Play It Forward, who you might know as the conductor of the choir of Hard Knocks and City Street Choir, another great Australian and great advocate for vulnerable people in Australia. And we've got this idea that you can nominate yourself or you can nominate somebody else just to sing out. You might get a group of friends together and sing the song. You might do it yourself and put it on social media. In whatever way you want, we're hoping to get the whole of Australia singing for Mental Health is Mental Health.
What a fantastic initiative. So really you're just asking, sing out loud. It's Absolutely. As easy as that.
Look, when we use our voices, we know that we can make change.
Yes.
And more importantly, when we use our voices, we know that we can build the community. And connection and community is one of the best things we can do for mental health.
Absolutely. How can people get involved? How can they find out more?
Jump on the website, afmh.org.au, and follow the links to A Country in Chorus. Nominate yourself, nominate somebody else. You can buy a hoodie, but there's some resources on there for you to post your stuff on social media if that's your thing. But otherwise, look, it doesn't matter who you're talking to. The more we all talk about mental health and the more we make it okay to talk about mental health, the better results we're all going to get.
Yeah, small conversation could go a long way for many people. So wonderful initiative. Chris Gambian, thank you so much for joining us today. I really appreciate your time. Thank you. And you can find out more about the Country in Chorus campaign at the website, as Chris just mentioned.